All right, so I'm Steve O'Neill, and I work in the OpenNotes program, and also work as the social work manager for overseeing all of the mental health and behavioral health programs, basically, at Beth Israel Deaconess Medical Center. OpenNotes is a movement, basically, and when I say a movement, it's that patients have a right to see their record. They already have that right. That's true in the medical side, and it's true in the mental health side. And all OpenNotes does is make the record immediately available so patients can see what we see. This is really about trying to get better partnerships with patients, but there's nothing proprietary about it. And my role in OpenNotes has been opening up notes so that any patient in mental health and behavioral health can see what we, therapists, our clinicians, have written about them in our notes. It's oftentimes kept as kind of the black box, the secret box, and I started in 2014 the first ever program to open up notes for patients and to see whether it improves patient engagement and trust and improves the care of the patients that we see. All of the hue and cry that we initially had that when we started OpenNotes that we were going to really increase the danger for patients and for staff, and we're going to be doing all kinds of bad things, and that we were ruining psychotherapy, as many people wrote to the New York Times after there was an article on the OpenNotes program coming out. None of that's materialized. And those few patients that have had some deleterious effect, those are usually things that, in fact, actually, if the patient would allow us to talk with them about it, we can explain it. So it's oftentimes that the patient views that this is not how I see it, but it might be how the clinician sees it. And that really should be a conversation between the two. When you go to see a physician, for instance, and if you're going and it's a well visit, generally the rule of thumb is that patients remember about 70% of what's talked about in the visit. But that still means they're missing 30%, and if they could see the note, they would better remember that 30%. And if a physician is delivering bad news to a patient, the rule of thumb is that they generally remember no more than 30%, oftentimes 20% of what's talked about in the session. So now if a patient that's just had bad news and has not been able to take in a lot of information can then see in the note later, can say to their family, oh, this might answer the questions that you had or that the patient had, it improves the care for that patient and for those around them. That's true in the medical side, and we're finding that is also true on the mental health side too. Many patients have described this, that there's an initial surprise about how much we write in there. They don't really realize, they oftentimes think, well, we talked to them and now we just write a simple thing that says, saw a patient and that's it. When we write pretty extensively, pretty comprehensively. And it's not until they get their record that they actually see that. So OpenNotes allows that, but it also, when patients say move and they have to get a copy of their medical record, it is a total pain to get that record. You have to go to medical records, you have to appeal to them. Most places charge copying fees by the page. And on this, if a patient that's in our OpenNotes program moves to another place, they still have that record online. The things that we're learning about from our own research is that for patients that we see on a pretty regular ongoing basis, they oftentimes read the notes initially when they first have access to those notes. And unlike in medicine, where a lot of our medicine patients, they read the notes in a pretty ongoing fashion, when patients are coming to see us on a very regular basis, those patients read their notes less often because a lot of the notes and a lot of the work that's going on is somewhat redundant. And by reading it less often, those patients report that they then have a better gauge of whether they're making progress or not within the therapy work that's going on. So some of our patients are teaching us that, in fact, actually reading every note isn't always good. It's sometimes helpful to space it out so that it has that effect. Again, those are things that should be talked about between the clinician and the patient. Clinicians' reactions when they find out about their notes being read, or it will be read, have been pretty universally, the clinicians are the ones that are the most hesitant, the most resistant to having this done. The fears that we've been able to find when we explore this with staff is that they're worried about saying things that the patient won't understand, or they'll be embarrassed by something they've written, or if they've not gotten their note in quickly, that kind of thing, like why is the note not in there, those kinds of things. So there's some embarrassment factors in there. But most of the staff usually embrace it, and certainly 4 years out, most of the 28 therapists at Beth Israel that started when they first did it, most of them were hesitant to start. All of them fully embrace it now, and the others that were resistant beyond the 28 that didn't want to participate are all but 2 are now involved in and have participated in it and embraced it and feel like it's a very good thing. Not one patient and not one staff person has asked to stop after starting OpenNotes. And that's also been true of all the other healthcare systems, including those systems that allow either patients or providers to opt in or opt out, as opposed to mandating it for everyone. So we're just not seeing it. People are afraid to begin with, and then that quickly gets overcome. The patient portal is really the platform that allows a patient to see the medical record in a secure platform. So we have it set up. You have to register for that. You have to do, enter it every time. So there's certain security aspects because we don't want it to be easily accessible in such a way that it can be hacked. So we have all kinds of safeguards in there. That's really the platform itself, the portal. The OpenNotes is really just the program itself that we have, where we're saying this note is open to you. So in that portal, when I write a note and I've signed my note in the system, or any clinician in our system does, the patient then gets an email that says you have a note that's available to read in the OpenNotes portal or in the patient portal. So in this spring, we will be moving towards a program that's called Our Notes. And the notion is basically for patients to be able to document in their own record. But we're going to start with just 2 key questions. And the 2 key questions are, for a patient who is coming in for an appointment, in advance of that appointment, they're sent the question, is there anything that's happened to your health or your health history that we should be aware of in order to prepare for your next visit? That's question number 1. And the second question is, are there any goals of care any things that you would like to address in this next session? That it's kind of that question that you don't want to be kicking yourself afterwards when you leave that session if you haven't asked that or had that addressed. And we oftentimes find that many patients will just say to us that they leave their physician's office or their nurse's office or their therapist's office and they wanted to ask about X, Y, and Z, and they forgot to do that because the time is so chock full. So this is a way to send those messages out ahead of time so we can make sure we providers are giving more patient-centered care in that way and attending to what their needs are. And that also helps us prepare for the session too, particularly if a patient reports something that they've had some issues with their health. We might say, can you get your labs drawn ahead of time before you come in so we can take a look at those together? When you're here, we'll have the results down. So we can do things like that. They can engineer the system in a different kind of a way.